Next, we have Maureen Rose Doran from the Penny George Institute for Health and Healing. She'll be speaking on an integrative approach to your well-being. Maureen Rose Doran is the lead nutritionist dietitian at the Penny George Institute for Health and Healing. She specializes in integrative nutrition, a science-based food is medicine therapy for prevention and treatment of chronic diseases. Maureen also has a master's degree from the University of Minnesota in health and well-being coaching and training in mindfulness-based meditation to help people achieve the changes they want to make for optimal health. A warm welcome to Maureen. We look forward to learning how simple changes within our lives can make big impacts on our health. Please welcome Maureen.
Well, my goodness, this is such an impressive event. And I really want to thank Amy and Pete, first of all, for putting together this incredible organization. And it's really grassroots, which is what Dr. White has been talking about and what we talk about as well, which is advocating and empowering ourselves so that we can really be who we've come here to be in our best way. I want to also thank you, all the volunteers, thank you, who really made this event come to life. And of course, Megan Holmes, I don't know if she's in the room right now. Thanks to Megan, that's why I am here. Megan did some volunteer work at the Penny George Institute for us, and you'll see a little bit of her work in a moment. I think how I'd like to begin is that you already know why your health is so impactful. You know whose lives you touch. You know what you need to do, and a lot of that discussion has come before me. Oftentimes we know what we need to do, but maybe we have trouble with the how. How do I do it? How do I incorporate exercise into my life? And that's where places like the Penny George Institute here in the Twin Cities can really come in to play. So as you could see here, 80% of our health happens outside of the doctor's office. 80%. And again, that's why organizations like this are so important, these grassroots efforts, because it's really what we do outside of the hospital surgery room and what we do outside of our doctor's clinic that can really have a very large impact on our health after we've been patched out or after we've been given our medication. So 80% happens. And again, families know oftentimes, thanks to you all, thanks to this organization, the basics surrounding, your disease. And they are learning how to become the best advocates for their health. And we at the Penny George Institute really understand, and we have the same philosophy when it comes to advocating for oneself. And ultimately, and this is so interesting that this topic this afternoon seems to be empowerment, seems to be self-care. A word that we often use is agency. And so, as I say, we are founded on the same kind of principles as this organization has been founded. We at the Penny George Institute really do understand what it's like. And we advocate for you advocating for yourself, and ultimately the power of your self-care. So we were started philanthropically, like your organization was started as well, by Penny George, who is the wife of Bill George, who was the CEO of Medtronic. And Penny George herself had breast cancer, and she was at Abbott Northwestern Hospital, and she's a psychologist by trade. And so she really understands that it's not just the body, but it's also the mind that's important to tend to when something critical happens in your life, like cancer or aortic disease. And so while she had excellent care at the hospital, she came away thinking, I think we need to be treating the whole person a little bit better than just the disease. And so as a result of that, she started what we call the Penny George Institute in 2003. And what we really do is we partner. You've heard the word empowerment. You've heard the word advocates. We partner with you so that you can be the best you can be. And a couple of years ago, in fact, we had proof of concept for several years with our topic with our field of integrative medicine. And we are now a specialty group, just like cardiology, just like nephrology, just like orthopedics, just like dermatology. So it's important to know that this field of integrative medicine has really come into its own and has really proven itself to be of value in terms of the health and healing process. So I also want to point out, though, that it's not an either or. It's not either conventional medicine or integrative medicine, and I'll explain integrative medicine in just a minute here. It's a yes and, that integrative medicine essentially supports the work of conventional medicine and expands on it. We don't want you to do acupuncture instead of having surgery. That's not why we're there. But acupuncture can certainly help you heal from surgery. Acupuncture is proven to help you with the anxiety that surrounds surgery, and that's why we exist. So it's a yes and. And so what is really integrative medicine? Well, it's as I mentioned, it's a healing-oriented medicine that really emphasizes the relationship between you and your doctor. We have much longer appointments. And typically, of course we're going to ask you, what's the matter? How can we help you? But we also make sure that we ask you, what matters to you? Because if we can tap into what matters to you, it's going to be easier for you to take on those things like exercise, like maybe healthier eating, like, stress management. And so we work pretty hard on that, identifying what really matters to you in your life and then building on that. And so we are informed by evidence. We use all kinds of therapies, as you've already heard me mention, acupuncture, nutrition. We have doctors and doctor of nurse practitioners who work in the newer field of functional medicine. We have massage therapists. We have aromatherapists. And we do have the largest inpatient, I haven't even mentioned the inpatient unit yet, or not unit, service, because we're all over the hospital. And these things can really make a difference in terms of your healing process. So it's definitely a field that is up and coming, and really, to a large degree, we're informed by what patients are looking for. So we became a specialty only because patients really felt the value of this and are demanding it through their health. So with that, this kind of gives you a little model of what we're about. But as I mentioned before, most of health and healing happens outside of the clinic. And it can be powered, it has to be powered by our own participation, our self-awareness, our care, and our attention to not only our body, but our mind and our spirit, what we eat, how we move, how we sleep, what do we do with stress? How do we manage our stress? So what we call sense of agency, which is essentially the same thing as empowerment or self-care, it means that we draw from that part in you who is ready to make changes on your own time, at your own pace, we recognize that the small changes are really the most impactful, because nothing begets success like success, right? And if we can do the small changes, then we feel good about that. And maybe we're able to do the next change, whatever that may be. So we also know that our sense of agency is really influenced by our environment, our community, our relationships. And so we recognize all of that. And we help patients navigate the dynamic interconnections of all of these things. So if you were to come to one of our clinics, we would be asking you about your sleep. We would be asking you about your stress level. We would be asking you for your story. What brought you here? How did you end up here? And oftentimes, to be perfectly honest, folks come to us when they haven't gotten the answers elsewhere. Now, clearly, this does not apply to, the aortic disease situation, because you get excellent care there. But it's these other things that might be going on. Maybe you have prediabetes, or maybe you have RA, rheumatoid arthritis, or maybe you have IBS, or, as was already mentioned, Crohn's disease, or one of the many, many autoimmune diseases, migraines, that you don't really feel like have really been addressed, or you feel like you could be a little bit healthier, but you just don't know what or how to do it. So even though this is a conference about the heart, you may have other things going on as well, that after you get the heart stabilized, maybe you're interested in looking at, wow, how's the rest of myself? What does my future look like now that I've got my heart piece under control? What about my XYZ? And so, as I say, we're really informed by evidence. And just to give you a brief idea of what it is that we might be referring you to, and within our clinics, as I say, we have all kinds of different modalities, and we talk to one another. The health professionals, we do a lot of internal referral. We do a lot of communicating about, I saw this patient for XYZ, and I saw them for this, and we put all those pieces of the puzzle together, and it results ultimately in your optimal care, we hope. And so you might wonder, where are we? We're in the Twin Cities here, but we have grown so quickly that we used to be in just one location, now we're in 21 locations. In fact, we're often embedded into primary care clinics, which is really where we should be, because a lot of this is typically owned by primary care. And as was already mentioned, oftentimes your doctor doesn't have enough time to talk with you about these more lifestyle things that you could be doing. So we're involved in 21 locations. We are also in the hospital, as I mentioned before. We have a lot of virtual visit possibilities. Most of our services are covered by insurance, and I think that's a really important thing. I believe that's because we're embedded in a fairly large healthcare system, as in Alina is a fairly large healthcare system. And so we can really maximize, the insurance potentiality, I guess I would say, much more so than perhaps your corner acupuncturist or your massage therapist. And this is a good thing, because it means that more people are going to be able to have more resources. And so we're basically insurance-based, although we do have low-cost retail options for those who might not be covered. And we do, as I mentioned, integrative and functional medicine, integrative and functional nutrition, integrative psychology. This is an important one, because I don't know for sure if this has been the case for you, but any of you who have gone through life-threatening situations, you may have been told, wow, we made it through, you're doing okay, but maybe in your mind you're like, whoa, what just happened to me? And you have to integrate that. And we have integrative psychologists who really help with that. And so we're here for you. We also do a lot of group work, because many times, as our integrative psychiatrist says, the group can be the medicine. And so when we do, for instance, preventing diabetes for people who have been diagnosed with prediabetes, and really the treatment there is lifestyle, so it's changing the way we move and the way we eat and the way we handle stress. But when you do something like that in the group can really support and help one another as they make these changes, and bring up their barriers, which could be addressed, and who knows, they could be someone else's barriers. They also bring up the solutions. So it's really group medicine is a really wonderful way to go about. So I just wanted to mention here in these few last minutes, integrative and functional medicine. I already mentioned a few of the diagnoses, but you have this in your folder. I think you have a brochure. But these are some of the things that we really work with, and they're oftentimes more chronic things where maybe you feel like, I think I could get better, but I just really don't know how, or maybe I need something else. And so it's more of these autoimmune things and these actually common things, but maybe you just feel you can get a little bit better with them. So that's what our integrative and functional doctors do. I mentioned that we do have Chinese medicine. I think we have 36 acupuncturists on staff. They're busy all the time in various locations. And I've also listed there the diagnoses that they have evidence for with treatment. They've gotten good outcomes. And this is just not our research, it's research across the country, actually across the world. And then we actually have what's called the Live Well Center, which is, generally speaking, it is retail, and it's more like body composition. And maybe you want to work with an exercise physiologist, not just a personal trainer, because you've got your Fitbit or you've got whatever the device is, but you're really not sure what's right for me. And so our exercise physiologist can really help with that. We also do a fair amount of weight management, really holistic weight management in that group. That's where our coaching comes in. And all of this can really make a difference in terms of your own health and well-being. And then, of course, part of my area is the nutrition area. So we practice both integrative. So we do a lot of inter-referrals, as I mentioned before. If I see someone, let's say with IBS, and we start working on maybe what the triggers are in terms of their food, it might become clear to me that that person really could benefit from acupuncture. They really could benefit from seeing one of our doctors, and then we'll refer, and they may have further testing, they may have medication changes, sometimes supplements are recommended, but again, everything that we do is evidence-based. And we do a lot around stress management too, because, as we all know here, that flight or fight response, it can really do damage in the body, especially if it's prolonged. And so we work hard with helping you to manage or mitigate your stress and how to respond to it. So with that, let's see if this little video with our star Megan.
We are here to support you in your health goals. Food makes a big difference in how you feel each day. We really believe food is medicine. Nutrition is important for every person's healthcare plan. At the Penny George Institute for Health and Healing at Allina Health, an integrative nutritionist can help you make lifestyle changes to lower your risk for chronic health conditions or manage current health concerns with more confidence. First, we will get to know you. Come on in and have a seat. A nutritionist can help you look at all of the symptoms that you've been experiencing, areas that might be out of balance, that we might be able to rebalance using food as medicine. Reducing pain, reducing inflammation, improving digestion, improving mood, your sleep patterns.
want to take that next step.
Getting ready for your visit is important. We want you to think about your relationship with food and your health goals.
I just want to understand the best choices I can make.
We can use all of that information to discuss your priorities, assess your current health, review your health history, examine your food patterns, and make a plan that feels really individualized, personalized, that you're ready to put into action. Hi! And it is so fun to see the transformation and the changes that can happen even in a couple sessions.
I feel like I'm on the right track here to get better.
If we can help you get nutritious food and foods that you're really enjoying, we're going to help every cell in your body work better so you can enjoy all the things that you love in your life.
So thank you, Megan. I don't know if you're in the room, but Megan did a great job on that. And by the way, you have that recipe in your folder. We often get asked for that. Where's that recipe? So with that, let's see, I think we popped ahead there. With that, I really want to thank you for your time, and just know that we're there for you. You have our brochure in your folder. We are ready, able, and willing to help you, and we really wish you the best. Thank you.